Welcome, everyone. We'll be getting started in just a few minutes. We want to make sure we give everyone a chance to join. So thank you for being here today, and we'll get started in a few minutes. All right, welcome everyone. Thank you for joining us today. I think we'll go ahead and get started. It's really exciting to see some familiar faces and friends joining us today. This is our second conversation of 2022, and I'm grateful for this opportunity to connect with you, to share FamilyWise news and updates. And most importantly, I'm excited that today we have Linsey McMurrin, our Director of Prevention Initiatives and Tribal Projects, with us today to share some really exciting developments from our Near Communities programs. As always, I want to start by thanking all of you for your support, which makes such an impact on the work that we do in partnership with families and communities. I wanted to start today by sharing a highlight from our Child Abuse Prevention Month campaign in April, which was the creation of 2 new resources for communities. First, FamilyWise is bringing new attention to the health and needs of Minnesota families through our first inaugural Family Wellbeing Index, which was released last month. The report looks at factors that help families thrive, from system-level formal supports, which we refer to as concrete supports, to personal relationships or informal supports, which we refer to as natural supports. One of the things that we learned from this report as we were doing the preparation for it is that there isn't a lot of data available about family strengths and supports. And that's important because we know we can't always change the impact of risk factors in our lives or in the lives of others, but we can strengthen protective factors like being able to ask for help. We know that giving and receiving help in our families and our neighborhoods has the power to change the trajectory of lives for future generations. And we've been doing a lot of work, especially with the support of the Sauer Family Foundation, to better measure family supports and those kind of core protective factors. We also have created a second resource that highlights our approach to natural supports, and we welcome 2 staff members, one of whom was a former participant, to share their experiences. If you haven't checked out these resources yet, I encourage you to visit our website. Just click on the latest on the main menu to find these and other resources, including our blog post series lifting up the perspectives of our staff on issues from 2-generation approaches to child abuse prevention to this month's post on mental health awareness. We are close to celebrating the 2nd anniversary of our merger with Minnesota Communities Caring for Children, and I'm excited to share that we continue to deepen our integration work in so many ways right now as an agency, and we've really started to see the promise of the merger come to life. At the time of the merger, all MCCC programs moved under a Prevention Services Department within FamilyWise. Today, Circle of Parents has been integrated into our Parenting Support Services Department, and several of our wraparound, supervised parenting, and parenting support services staff have been cross-trained as presenters of our Understanding NEAR presentation. And by NEAR, we refer to neurobiology, epigenetics, adverse childhood experiences, and resilience. It has been meaningful and motivating for our staff to learn from each other and build on each other's strengths. Similarly, prior to the merger, MCCC had been a champion for parent leadership and worked to build the confidence and skills of parents as advocates for parents, children, and families in community and system settings. Funding for this work ended as the merger was in process, and FamilyWise has been committed to rebuilding a parent leadership program when the opportunity arose. I'm pleased to say that FamilyWise will be partnering with the Minnesota Department of Human Services for a parent leadership program, and that it has been energizing to reimagine a parent leadership program collaboratively with staff across departments because it fits our values and our approach so well. Through the merger, FamilyWise has become a statewide agency, and we recently set up a new contract with Sherburne County for supervised parenting and parenting education services. This is yet another way we are seeing the promise of the merger come to fruition as we continue to expand services outside of the metro area. I also feel at this time that I want to make sure we take some time to address recent events. Safety is always one of our highest values. And as you may have heard, we had an incident at our Minneapolis building in late April. There was a shooting that occurred as two parents were picking up their children from their supervised parenting visits. Staff acted swiftly to lock down the building so the children were safe. Police responded quickly. The victim is continuing to recover, and 2 individuals have been arrested in this case. The safety of our participants and our staff is our highest priority. We have conducted our internal review and all of our safety protocols were followed during the incident. We are incredibly proud that our team acted with great care to mitigate risks and to prevent the situation from becoming worse. We are working with the parent who was a witness and then with the parent who was a victim to connect with supportive resources. And we continue to work on providing listening sessions and support for our staff team. It's a reminder that we do hard work and that we take every action to protect children and their families. This was a scary incident and it was a tragic incident. And we will continue to have conversations around physical and psychological safety in the months to come. And we also know that because of our work, thousands of children have been able to safely see their parents. We talk a lot internally and externally about trauma and mental health. And so this brings me to the last topic that I wanted to briefly touch on before I turn it over to Linsey. May is Mental Health Awareness Month, and I want to remind you to check out our latest blog post featuring staff perspectives on mental health as key to well-being. Mental health is integrated in all of our work, whether we're working one-on-one with parents, children, in families, or in communities. Families involved in child welfare and court systems often feel overwhelmed and isolated, making it hard to ask for help and make self-care a priority. We all deserve wellness, so it is important for us as service providers to show compassion for others and ourselves, and to make our mental health a priority. This is part of our approach at FamilyWise, and through our Near Communities program, we train parents, community members, and service providers to understand just how important compassionate and supportive individuals and communities are to our collective health and well-being. Which brings me to being able to turn it over to Linsey McMurrin, our Director of Prevention Initiatives and Tribal Projects, to share a few updates with you about the work that she and her team are doing in partnership with the communities. Linsey, thank you so much for joining us today. We're so excited to hear what you have to say.
Miigwech Ann. Puju, gawin na pagini na ta ang sinabi mo si, nang gago ko jatun na sinabi mo yan. Ni Linsey, indigenous ka jaganashimang, Kazakh Jamaica, and Dunjaba, Idash Walker, and Da. So my name is Linsey McMurrin, citizen of the Leech Lake Nation of Ojibwe, and that was a traditional greeting and introduction in Ojibwe. I always like to start out our time together with. As Ann mentioned, I'm Director of Prevention Initiatives and Tribal Projects, and work within the Prevention Services Department, primarily on our NEAR programs. And so I loved what you had to say, Ann, about mental health awareness. A big message I try to carry through all my work is the idea that self-care is community care. I think so often we as helping professionals, or taking my professional hat off, and me as a mother, tend to feel that self-care is a luxury. And what we really want people to understand is that it's not, it's a necessity, it's a responsibility. Because we know that when we attend to our own needs and when we're modeling that actively for others, that is when we are best suited to support and take care of others in a good way. So we really encourage folks to take that little shift, that perspective shift. I know it was important for me. Sometimes I felt selfish to prioritize taking care of myself. And what we now know and understand is that, again, it's one of those responsibilities and obligations if we are to be able to pour out from our own cups and offer others the very best of what we have to offer. So speaking of the idea of community care, that is really what our Near Communities and Tribal Near projects are all about. We use a concept, a theory of change called building self-healing communities. And that's really what grounds both projects. And it's based on the principles we've been talking about. And so both our Tribal Near project as well as our More Resilient Minnesota project really hinges upon that. So as Ann mentioned earlier, that acronym NEAR stands for the neurobiology, epigenetics, adverse childhood experiences, and resilience. And I want to say a couple words about that. Resilience seems to be such a buzzword these days, and I want to make sure that we're underscoring that we're using it in a very specific way. You know, oftentimes when people hear resilience, they think about it as an individual's ability to bounce back. While yes, we agree that that certainly is a part of the puzzle, you know, we also need to think about the inherent strengths within those individuals in the first place, the skills that they've had the opportunity to pick up or that they have not had the opportunity to learn about, and about how it really is about that overall holistic wellness and capacity building, right? What is it that I might not know how to do well yet? We also stand by the fact that resilience requires connection to caring and competent people, those relationships that really matter and are going to make that positive difference in the way that we are interacting with one another, the way that we move through life, where we seek support from, as well as ensuring that supports and resources within a community are accessible, equitable, and culturally responsive. And so what we're really talking about here on both ends of the spectrum is systems change work, right? And we know that might take time and that there's so many things that we can do along the way as we're working towards that. And so these two initiatives, I'll start with the More Resilient Minnesota work, funded by the Minnesota Department of Human Services, really seeks to improve the health and resilience of current and future generations. So as part of this initiative, we work with children's mental health and family services collaboratives across the state, coming alongside them to educate their communities about neuroscience. And this is the important part, building capacity along the way within that community by training local presenters that will share this information widely within their spheres of influence and go on to be those community champions that really work to take this self-healing communities model beyond the 3-hour presentation and to really think about how to integrate that into everything that we do within community. That capacity building piece is important because we are encouraging communities to, there's a quote by Eduardo and Bonnie Duran, and they say the first thing we should do in community is to ask the community what is important to the community, right? So emphasizing the voice of those most impacted is a large piece of this work as well. So in addition to that training of local presenters, we help collaboratives move from simple awareness of ACEs and the other traumas that we mentioned and translate that into action, right? So now that we know this, what can we do about it? And through hosting of community conversations, in which a requirement is to make sure that everybody is around the table, that there is diversity that reflects the community itself represented, that folks have a voice in that planning process as they ultimately work towards creating resilience plans for their community to move forward and act upon. So that is kind of in a nutshell what our More Resilient Minnesota initiative really strives to do. And then of course, throughout that process, it's continually guided by community wisdom, local data, you know, the knowledge of those with experience, right? Those that have experienced the hardships, those that have experienced successes, and really how can we lift that forward, help the community feel ownership over the process and continue on doing this good work long beyond our involvement there within that community. The second piece I want to talk about is our Tribal Neuroscience and Community Wisdom project. I feel a little bit of ownership of it because it's my baby. The project is a collaboration between our tribal nations, our organization at FamilyWise, and the Center for Prevention at Blue Cross and Blue Shield. And it's interesting to note that the collaborative project, the More Resilient Minnesota work, was largely modeled after the tribal project itself. So the tribal project follows kind of that same phasing in of including knowledge expansion, as well as then listening to the expertise that exists within the community. So we really also rely on that traditional knowledge and community wisdom as an important focal point of the work. In addition, with our tribal project, we really try to bring in the understanding of historical trauma, impact of colonization, and how it relates to both individual and community health and well-being in our tribal communities and beyond. And so our tribal project, this go around, has really focused. We originally thought we would be doing a lot of in-person engagement opportunity. As everybody knows, over the last couple of years, everybody has adapted. And, we've been really pleasantly surprised with some of the changes that has brought about. A main thing that has done is allowed us more time to focus in on a podcast series called Remembering Resilience. We worked on our second season of the podcast series. It is now live, not only on our Remembering Resilience website, but as well as on most major podcast platforms. So if you go to whatever your favorite platform might be and just search Remembering Resilience, you will find us there. Thank you, Kate, for popping that in. And what our podcast is about. The series highlights Native American resilience through and beyond trauma, exploring concepts, science, history, culture, stories, and practices that we are working with as we seek to shape a future for our children and our grandchildren that is defined not by what we have suffered, but what we have overcome and all that we have to offer everyone else in moving through their own journeys, no matter how you identify culturally. And so we are also happy to announce that we'll soon be offering facilitation guides and conversation guides. Communities, organizations, agencies can take a deeper dive into the content of the podcast themselves. And those will be launched hopefully in June. We'll keep everybody in the loop as we get those going. I appreciate Anna and other teammates on this call's help with that as well. And what we really want to name that was an important piece of the development of the podcast and those conversation guides is that we always want to keep at the forefront of our collective thinking about how we can make sure that our work will continue to have an impact long after the timeline of our project. And so, this Remembering Resilience podcast series and the accompanying resources will be such a great example of, number one, the power of storytelling. Storytelling traditionally in our Indigenous cultures has been our way of relating information from one generation, one family, one individual to the next. And so to be able to incorporate that to make this podcast series in a really culturally responsive way has been very empowering for me and my podcast co-hosts, Susan Bolio and Brianna Matrius. So I should also mention that podcast has been a collaboration with the University of Minnesota Extension with their American Indian Family Resilience team. And so it's been a great collaboration as well to continue to grow our partnerships across the state as we all do this important work. So if you're wondering how you can find out more, how you can continue to be involved in this work, it brings us to our invitation to all of you. We are so excited to announce our 5th annual gathering of collaboratives and tribal nations addressing ACEs is taking place on June 16th. It's a free virtual day-long event open to everybody. And the Growing Resilient Communities Gathering is an annual statewide event that supports our children's mental health and family services collaboratives, as well as the Indigenous communities across the state as we continue to work to build those self-healing communities across Minnesota. All are welcome to join. We encourage you to share with your networks, we'll share widely. And our event is being offered, again, to really help with those community-wide implementation efforts. We are talking a lot in this year's conference about systems change and looking at that through 2 different lenses. So one thing I will highlight is that we're having 2 panel discussions. The first will be taking a look at how statewide prevention agencies and organizations are doing the work. So we have a number of panelists, everyone from, we have restorative practices at MDE being featured, at the Minnesota Department of Education being featured, as well as our statewide suicide prevention efforts. We have our SHIP communities and their efforts being talked about too. And what's important and exciting for me about this is that we're looking at systems change in all of this, right? How can we continue to promote change of systems, both at the statewide agency organization level? And then our second panel discussion will be about community grassroots organizing, because that systems change too, right? And we're highlighting a number of different organizations across the state who have been working with the Center for Prevention at Blue Cross Blue Shield through the same cohort opportunity. Our Remembering Resilience work, our tribal project work is supported by, to talk about how we work together for equitable results across the community, and really telling those stories, right? What has this work looked like as we've adapted through the last couple of years? And hopefully folks will get a more concrete ideas in terms of how agencies and organizations have been working to support the needs of community. Again, both at the statewide level, agency level, as well as the more local grassroots level also. And I got really excited and jumped ahead a little bit and started describing breakout sessions. I should also mention we are so pleased and honored to bring our keynote speakers, Jerry and Wendell Wakau from the Menominee Nation, to tell the story of their tribal nation. And they have done amazing things. So the brothers, one is a school administrator, the other is the head of healthcare for the tribe. And we've worked with them in the past through the tribal project and just been amazed at their journey over the span of now 15 years and really implementing everything we've been talking about with our tribal mirror and our more resilient Minnesota projects throughout their tribal nation. And so that'll be our keynote speaker. Really excited to hear their stories and to start to think about how is it that we can take those lessons and implement them here in Minnesota. We have a number of other great breakout sessions lined up too. I honestly want to attend every single one of them. And it's always a great problem to have, right? When there's so much interesting work being done. I know Kate popped into the chat the registration link. Shortly, we'll have some more descriptions and a more comprehensive registration brochure coming out about that event. And so you might be wondering, who is our target audience for something like this? Everyone within the community. Part of our work that we do throughout our NEAR programs is to really promote that, yes, we want professionals around the table, and we want parents, we want community members. They have so much expertise to offer as well. We recognize that right alongside those of us who might have initials behind our names. And so that is a huge push and a huge goal for us, I think, is to really understand that it takes the entire village, right, to do this work. And we really want to honor the time and commitment of everybody within that continuum and coming together for that. So whether you're involved with a collaborative or a tribal nation or not, or if you want to get more involved, we really encourage you to attend. We welcome folks from healthcare, law enforcement, education, social services, again, parents and caregivers, businesses, nonprofit organizations, anyone and everyone is welcome and encouraged to join us as we come together to work towards a brighter future for our families and for the future generations to come. So with that, I've thrown a lot at you in a short period of time. I do want to pause and just open it up for questions. If you have questions about any of the things Ann chatted about, anything that I shared with you so far today, miigwech for your time.
Thanks, Linsey. So we'll welcome your questions or comments if you want to put them either in the chat or I believe that you can just unmute yourself and ask a question.
I do want to shout out Linsey the Remembering Resilience podcast, and she kind of admitted that I've been helping her with some administration tasks, but I've gotten a chance to listen to some of the episodes, and it is really good. And it's really well made and entertaining. So I do have to agree add an additional plug for that. That's a really cool project.
Miigwech, thank you.
I was also going to plug Linsey to say, I think Linsey, you are also leading a breakout session at the gathering. So if folks would like to hear more from Linsey, that's another opportunity.
I think we have to just acknowledge and recognize that in a time where people felt so isolated and so separated, this work really helped us. Like the idea of a podcast to bring people together was creative and innovative, and just, I think, so bringing so much hope to people, to give them the opportunity to hear from their elders when they couldn't be with them in person. So such a lovely way of adapting to the challenges that we've had in the past few years. Any other questions or comments from anyone? Monica, I see you in the chat saying that you're glad you tuned in today, and we're certainly very glad to have you here, and welcome all of you for participating and just being such great supporters, and helping us guide our work and helping us be there for families and communities. Anyone else here feel like they want to be where Linsey is, under all the trees and in the forest? If it makes you feel any better, Linsey told us that they have a frost warning for the night. So
yes, our northern Minnesota is beautiful, and we're a little bit behind weather-wise, I think. Our lakes just recently went out, ice out, thankfully in time for opener, but there was a little bit of concern whether they'd get boats on the lake or they'd be ice fishing still.
I'll give it one more minute if anybody has anything they want to say. Otherwise, again, very deep felt gratitude for you all joining us today. We really appreciate you and the ways you enrich our work. So I hope you have a wonderful rest of your afternoon, and look forward to seeing you again.
Thank you.
Miigwech. We'll see you again soon.